How much movement do we need? So we've been told for decades that we need to keep moving and that we should be getting lots of physical activity each week, with the payoff being reduced risk of heart disease, improved blood pressure, better cholesterol, lower risk of type 2 diabetes, reduced risk of cancer, a reduction in the risk of falls. The list literally goes on and on. And this is a great investment in our health, but there's some questions around what that looks like. How much is enough? So while there is no really hard and fast rule for cardiovascular exercise or activity, there's a general consensus that's about 150 minutes a week. So that can be 30 minutes 5 times a week or 50 minutes 3 times a week. Of course, if you're new to this kind of work, you might want to start with just 10 to 20 minutes a few times a week and then work your way up. The last thing we want to do is really set ourselves back with an injury from doing too much too fast. And if you're not doing a ton of movement, probably don't want to jump to that full 150 minutes right away. But when we're talking about how much, what we're really discussing is exercise volume. And volume's a combination of 3 factors: duration, how long you exercise, frequency, how often you exercise, and then intensity, which is how hard you work during exercise. All 3 of these are important, but intensity is often the most overlooked yet crucial aspect of making our exercise effective. So that leads us to that next question of that how much, what is that? How intense is enough? So think about if you're going for a walk around the park with a friend, is that enough? Well, maybe. It's maybe enough. It's maybe enough. It counts if during your walk you're able to have a conversation with your friend, but if you went any faster, it would be too much to walk and talk at the same time. This is called the talk test, and it's a simple way to check if you're working your cardiovascular system at a moderate intensity. If you're chatting away easily while you're doing the activity, you might want to pick up the pace a little bit. But on the flip side, if you're huffing and puffing so much that you can't get a word out, it's probably time to dial it back. This sweet spot of moderate intensity is what experts call zone 2 exercise. And it's where you're challenging your heart and your lungs at a moderate level, and for a level that you could continue for 20 to 45 minutes. Again, this zone 2 exercise refers to a type of moderate intensity cardiovascular training that focuses on maintaining that steady state, that moderate heart rate for an extended period. Typically, people measure the heart rate during this. For zone 2, your heart rate wants to stay between 60 and 70% of your maximum heart rate. There are many different formulas to calculate your maximum heart rate, but personally, I like the maximal heart rate equals 207 minus 0.7 times age. So if you're 40, your max heart rate is going to be 180, 45, 173. If you're 55, you're looking at 170, and so on and so on. And then to calculate your zone 2 heart rate range, we want to multiply our max heart rate by that 60% to 70%. So you're going to take that max heart rate that you've calculated and then just multiply it by 0.6, multiply it by 0.7, and you're going to get that range. So for 40, that range is going to be from about 108 to 126. For 45, 106 to 124. For 50, 104 to 121. For 55, at 102 to that 119. 60 is going to be about 100 to 116. And then obviously you can use the talk test, which is, again, walking, able to carry a conversation, but if you increased your pace, your cadence anymore, you wouldn't really be able to hold that conversation because it would be too much. So start moving, go on a walk with a friend, or strap on that Apple Watch, and keep an eye on your heart rate as you walk, run, bike, hike, or treadmill, whatever you choose that you can be consistent with, and that keeps your heart rate in that zone 2 for an extended period of time without taking a break.